Hello everyone, a very good afternoon. So today is another webinar from Alleviate Pain Management Clinic. Myself, I am Dr. Javed. I'm a pain management physician at Alleviate Pain Clinic, and today I will be delving on a very intriguing subject, that is fibromyalgia. So let's start and let's see what is fibromyalgia and how whether it is a myth or it's a reality. Let's try to throw more light on this, right? So yes, this is the overview of my presentation, and I would be talking under the following headings. To start off with the introduction, uh, what is fibromyalgia? Is it a myth? Is it a reality? What is it actually about? The pathophysiology, diagnosis of fibromyalgia, how it should be made, and what all parameters we need to keep in mind. The management of this problem, of this chronic pain problem, and we will end with a take-home message. Right. So coming to the introduction, we know that in today's day-to-day life, mental health is very important. I would say it is as equally or even more important than the physical health. The reason is a lifestyle due to which the mental health problems are on a steep rise all over the world. Among them, there is one such problem called as fibromyalgia. Fibromyalgia, there's a lot of confusion. Few people have heard about fibromyalgia. It is getting mainstream attention now. And a few of the patients have heard about it. Many of the doctors know about it, but still there is a lot of confusion regarding this particular entity, not only among the patients, but among the treating doctors as well. So let's shed more light on this. So fibromyalgia, when you look at the term or when you hear the term fibromyalgia, a number of things come to your mind. Is it a disorder? Is it a dysfunction? There are a lot of symptoms. Is it a hormonal problem? Is it just a body disturbance? What are the evidences regarding it? Is it just a functional problem? Is it a psychiatric problem? A lot of confusions, right? So let's try to clear all of these things. Other important thing which comes to mind is whether it's a myth or is it a reality, right? So now let's try to look at a certain case history. This was a case history. I had a patient who had come to me last week. A 28-year-old female comes to my OPD. She complains of pain all over her body. She says that her daily activities and is not able to sleep as well. On examination, she looks anxious and she screams in pain when even gently touched for palpation, for examination. She shows me her investigations, and she has a few blood reports, a lot of scans, and everything is within normal limits. Everything is normal. The patient says she has visited a lot of doctors over the years and has been prescribed a lot of painkillers, but she has had no relief. The important thing is she says that her family members think that she is faking an illness. So when we as doctors are in the OPD and looking at patients, a lot of patients come to us with similar complaints. And many of the time, we just end to blatantly dismiss them off, telling that it's just a chronic pain syndrome or just some pain, take some painkillers and then go. But there are a certain category of patients who do not come under this bracket, in the sense they have complaints all over the body, complaints of pain, but then we need to evaluate and find out whether they come under the dimension of fibromyalgia. So coming to the diagnosis of this, yes, this patient comes to me, pain all over the body. She has been visiting other doctors earlier as well, has taken a lot of pain medication, but still has no pain relief. So what is the diagnosis? Right. So the diagnosis of this patient, I did a clinical examination. The patient's symptoms fell under a certain category, and this patient, I diagnosed her to be fibromyalgia. After starting her on the specific management plan for fibromyalgia, this patient did see the day of light of good treatment, and she has been able to manage the symptoms well and carry out her day-to-day activities now with a good amount of pain relief. So what is fibromyalgia? Let us break the term. Fibro means tendons, ligaments, tissues, etc. Myo means muscle. Algia means pain. So this is a pain involving muscles, tendons, ligaments. Is it just that? Let's see. So remember, even though it is, as per the name, seems to be like a musculoskeletal disorder, the funny thing is it is not a musculoskeletal disorder. It's something very, very complex. It's a complex syndrome characterized by pain amplification, musculoskeletal discomfort, and wide range of systemic symptoms. Right. So let's have a look at how common this problem is. By the look of it, you might think that this is quite a rare thing, but it is not so rare, right? The prevalence is that it's quite common worldwide. In our country, especially, it is even more common. The reason being that a lot of cases go undiagnosed. It affects 2 to 4% of the population, and women are affected more compared to the male counterparts. Right. So in fibromyalgia, as I said, it's a complex syndrome. There's not just pain in the muscles or bones, there is more to it. As you can see over here, it's starting from head and till going on till the toe. So there is going to be cognitive problems, memory problems, sleep disturbances, headaches, dizziness. Easy fatigability is one very common complaint with which patients come. There's going to be pain all around the jaws, problems with vision. There's going to be a lot of tender points, something called as a tender point all over the bodies. We'll go into details of it in the later part of the presentation. Pain in the muscles, yes, they have problems and symptoms from each and every symptom, each and every system of the body. Central nervous system, respiratory system. Coming to the GIT, there's going to be gastritic issues. They suffer from gastritis, nausea, vomiting, etc. Urinary problems are common. Joint pains, morning stiffness, restless leg syndromes, skin-related problems. You name it, they have it. So let's have a look at the pathophysiology of this problem of fibromyalgia. So remember, this is a diagram over here. So any noxious stimulus, for example, a pin is pricking to your finger. How do you sense the pain? Well, I have drawn out the path through which you sense the pain. So any kind of a pin pricking you, the nerve fibers around your fingers are going to get stimulated. They carry the pain all the way down through certain fibers called A delta and C fibers. This is for the pin. There are specific fibers. For a feather touching your palm, again, there are separate receptors over here. That's how complex it is. And then they are carried all the way along through the A beta fibers. They reach something called the dorsal ganglion and into your spinal cord, right? In the spinal cord, again, there is another tract called the spinothalamic tract, which carries the pain impulses all the way going up, going up, going up, and reaches the brain, namely the important areas like sensory cortex, thalamus, and the limbic system, right? So when this happens, the body is going to react to the pain, right? So you would have felt that, after you've got a prick, you feel the pain at that moment, and then the pain is coming down, right? So how does that happen? We have something called as a descending inhibitory pathway over here. The body reacts to which it sends certain pain relieving substances through this, right? Certain hormones to the descending inhibitory pathway, and it inhibits this particular impulse or symptom, and it cuts it off. So this is how a normal pain cycle is. Now, what we need to understand is in fibromyalgia, it's a central pain mechanism. So what happens, I was mentioning about a certain thing called pain amplification. So there's something called a sensitization, right? central sensitization, especially. What is it? It is nothing but generalized heightened pain sensitivity in fibromyalgia patients. For example, that normally if someone is pricking with a needle, you feel pain, whereas if you are touching with a feather or a cotton bud, you feel a touch sensation, right? In fibromyalgia patients, the pain sensitivity is heightened. For example, even if you touch the patient, right, with a bud or a feather, they feel that they're being pricked. And this happens why? Because of something phenomenon called a central sensitization, wherein the nerves become very sensitive, right? Other things are in fibromyalgia, there is increased activation of the second order neurons in the spinal cord. Right, there are two types of second order neurons, the nociceptive specific neurons and the wide dynamic range neurons. So, central sensitization of the nociceptive neurons leads to nociceptive nerve impulses being perceived as more painful. This is the hyperalgesia, right? For example, the meaning of the statement is if you are pricking, right, you feel some kind of a pain on your finger. Whereas if the finger is being cut, there is a severe pain, right? So, what happens is in such patients, in patients with fibromyalgia, a pinprick can feel like the finger is getting cut. That is the amount of pain they perceive. Next is central sensitization of wide dynamic range neurons leads to non-nociceptive nerve impulses being perceived as painful, that is allodynia. What is the meaning of this statement? It means that if you take a bud and you touch your finger, you feel a touch sensation. It's a small, gentle touch. Whereas in fibromyalgia patients, when you touch the fingers with a bud or a feather, they feel that the finger is getting cut. That's the severity. So, what you need to understand from this is fibromyalgia is no longer a myth. It is a reality. What we need to understand over here, that patients are coming to us with fibromyalgia, we need to listen to them, and they are actually suffering. They are not faking an illness. So this is an awareness what we need to bring about among the general population, that hey, fibromyalgia does exist and it is very, very, very distressing. Okay. So let's look at this tabular column over here. What is there over here is, again, any kind of a tissue damage, right, leads to peripheral sensitization. Tissue or nerve damage leads to peripheral sensitization, right? And this leads to central sensitization. Decreased threshold to peripheral stimuli, increased spontaneous activity, expansion of the receptive field. There is hyperalgesia, allodynia, spontaneous pain, and spread of pain. So again, a look at the pathophysiology, the role of central sensitization. First, impulses from afferents depolarize dorsal horn neurons. Then extracellular calcium and nitric oxide diffuse into neurons and cause exaggerated release of substance P and glutamate. This results in neuronal hyperexcitability. Finally, a pain signal is sent to the brain from the dorsal horn. So in fibromyalgia, dorsal horn neurons become hyper responsive to nociceptive and non-nociceptive somatic stimulation. This is called a central sensitization and results in hyperalgesia and allodynia. But the fact remains that even after putting forward these theories and extensive research, the pathogenesis of pain in a patient with fibromyalgia is not clearly understood. However, central sensitization still remains as a leading theory of this disease mechanism. Now, let's have a look at how to diagnose a patient coming to you with fibromyalgia. Remember, as I said, they are commonly missed, commonly misdiagnosed. So, what is the key to making a diagnosis? So, the key to making the right diagnosis of fibromyalgia is clinical examination only. No lab findings, no scans, no blood tests, no investigations are going to prove to you that the patient is suffering from fibromyalgia, except your clinical acumen. Your clinical diagnosis ability or skill has to be sound enough to identify a patient suffering from fibromyalgia. Right. So there are a lot of criteria. Initially, there was something called as the ACR criteria, which was used. And as per this criteria, there had to be a widespread pain for 3 months duration. There are certain thing called tender points. Out of the 18, 11 had to be there. Its specificity is 81%, sensitivity is 88%. So the anatomically specific tender points are there or specific regions of the body. One is occiput, other is lower cervical paraspinal, anterior aspect of the space between C5 and C7. Trapezius, again, at midpoint of the upper borders. Supraspinatus, above middle scapular line. The second costochondral junction. The lateral epicondyle, upper quadrant of the buttock, just posterior to the greater trochanter, knee medial fat pad just proximal to the joint. So these were the tender points. But this criteria had limitations because of the variation in the patient's kind of presentation and symptoms other than pain. So let's have a look at the frequency of symptoms. Muscular pain is present in 100% of patients, fatigue in 96%, sleeplessness 86%, joint pain 72%, headaches, restless legs, paresthesia around 50%, memory impairment, poor concentration, anxiety, depression, like cramps are also present. So this is the most simplified diagnostic criteria which I use in my day-to-day practice. This is called as the WPI index, widespread pain index, 0 to 19. So there are certain points over the body which you need to mark wherever the patient has pain, like neck, shoulder, upper limb, lower limb, legs, upper back, lower leg, hip, chest, abdomen, jaw, etc. Make a note of it and fill your score over here. And along with that, there's something called as a symptom severity scale over here, 0 to 12. And now you need to ask the symptoms: fatigue, waking unrefreshed, memory, attention impairment, somatic symptoms, etc. And you need to mark how much is the severity. So duration of symptoms, underlying disease, medication. So when is it going to satisfy the criteria? If the widespread pain index is more than equal to 7, SSS score is more than or equal to 5, or WPI 3 to 6, SSS more than or equal to 9. Symptoms have been present at a similar level for at least 3 months. At least 3 months is what is important. The patient does not have a disorder that would otherwise explain the pain. So moving ahead with the diagnosis, we need to understand, as I said, it's mainly a clinical examination diagnosis. There are no characteristic lab findings. And of course, when you take a blood test, there are a few biochemical abnormalities which you can look at. One is substance P in CSF is 3 times higher in the FMS fibromyalgia symptom patients. The serotonin levels in platelets and CNS are low. ATP levels are low in RBC. There are trigger points. Dysfunction of the HPA axis. Growth hormone levels are low. Nerve growth factor was 4 times higher in the CSF. So let's have a look at the various differential diagnosis, because we need to keep this in mind as well before coming down on diagnosis of fibromyalgia for any patient. Endocrine disorders like hypothyroid, vitamin D deficiency, osteomalacia, psychiatric depression, major depression, infections, Lyme's disease, EBV, viral hepatitis, HIV, parvovirus infection. Rheumatological conditions are often confused with fibromyalgia, namely ankylosing spondylitis, rheumatoid arthritis, osteoarthritis, SLE, and polymyalgia rheumatica. Muscle-related problems, again, very prone to confuse with these problems as well. The myofascial pain syndromes, metabolic myopathies, inflammatory myositis, neurological like spinal stenosis, cervical myelopathy, multiple sclerosis, myasthenia gravis, peripheral neuropathies. Others include malignancies or statin therapy myalgias. Right. So let's have a look at the management of this problem. Remember, multidisciplinary approach is what is required to tackle this chronic problem. It includes pharmacotherapy, non-pharmacological therapies like physical rehabilitation, psychotherapy, interventions, etc., etc. So pharmacotherapy is like medications, medicines which are given for patients with fibromyalgia. Remember, the patient I was talking to you in the initial part of my presentation, she was already prescribed analgesics, but she did not have any kind of a pain relief from them, right? So we need to keep in mind that only analgesics are not going to help, especially NSAIDs do not have much of a role. Paracetamol, tramadol to an extent, yes, they can be used to provide mild amount of relief, pain relief. Co-analgesics are what assume the more important role over here, especially the antidepressants, anticonvulsants, antidepressants like SSRIs, SNRIs, etc., anticonvulsants like pregabalin, gabapentin, etc. So let's have a look at the medications commonly used in fibromyalgia. Amitriptyline is used. Mechanism: serotonin, norepinephrine, dopamine reuptake inhibitor. So TCA, dose is 10 to 75 milligrams. Cons: the disadvantages with this is it is anticholinergic and sedation, confusion, weight gain. Duloxetine, the SNRI, is a very important drug in management of fibromyalgia. Dose is 30 to 120 milligrams. It is FDA approved. And it manages patients with symptoms like anxiety, depression as well. The side effects are interactions, nausea, serotonin syndrome, etc. Pregabalin, the calcium modulator, it's also FDA approved. Dosage 50 to 450 milligrams. The side effects include sedation, weight gain, cognitive impairment, etc. Milnacipran, the norepinephrine, it's again an SNRI, dosage of 100 to 200, and it is FDA approved as well. The side effects are cardiac effects. Tramadol, again, remember, it is not just an opioid agonist, it has central action as well. It is serotonin, norepinephrine reuptake inhibitor. 50 to 400 milligram of a dose can cause nausea, vomiting, dizziness, serotonin syndrome, etc. Pramipexole, the dopamine agonist, 0.5 to 4.5 milligram. An advantage of it is actually weight loss. It is commonly used in management of restless leg syndrome. Cons are nausea. Fluoxetine, serotonin reuptake inhibitor, 20 to 80 milligrams, and using cons are again serotonin syndrome. So let's have a look at the FDA approved medications. They include pregabalin, duloxetine, and milnacipran. So these are the three drugs which are FDA approved for the management of fibromyalgia. Right. So let's have a look at the treatment recommendations. First line, use the FDA approved drugs, pregabalin, duloxetine, milnacipran, right? And non-pharmacological things like aerobic exercise, cognitive behavioral therapy, CBT, patient education, etc. are important. TCS like amitriptyline can also be used. They have shown good results in patients with fibromyalgia. Second-line medications include tramadol, citalopram, and fluoxetine. Strength training, acupuncture, biofeedback hypnotherapy might help. Third line are like massage therapy, ultrasonography, electrotherapy, etc. Not recommended are opioid. This is an important list which we need to keep in mind because most of the patients are put on these medications who are suffering from fibromyalgia. And remember, these have not much of a benefit, right? So what are these medications again? Opioid analgesics, and then we have the NSAIDs, corticosteroids, benzodiazepines, calcium, thyroid hormone, etc. So moving ahead, again, these are the medications again: duloxetine, milnacipran, pregabalin, FDA approved ones, okay, and the other medications. So non-pharmacological treatment assumes a lot of importance over here as well, and it should be actively pursued and given to the patients. Education is what is most important. The patient, not only the patient, but the patient's family members need to be educated about this condition. You need to spend the time with the patient, at least about half an hour to an hour, trying to explain to them what is actually happening, because this is the most important thing as a doctor, what we need to do for our patients, that is explaining what problems they are suffering from in a way that they can understand. And I see that the patient compliance improves a lot. They start to accept the fact what has actually happened, because many of our time there is a lot of confusion regarding this particular problem. Cognitive behavioral therapy, the psychotherapy definitely helps. I always take the help of my clinical psychologist whenever a patient comes with fibromyalgia, because remember, it's a multi-pronged approach which is going to help these patients. It is not like one drug fits all, or one thing suits to all kind of an approach. It is not going to help over here. You need to use a multidisciplinary management approach. Exercise is very good. Aerobic exercises, swimming, walking, cycling, all of things is good. But remember only one thing over here. This is what the patients get confused a lot with. Whenever they come with pain, they are like, sir, if you do walking, if you do exercise, the pain is going to increase. I say to them, yes, definitely the pain is going to increase when you do exercise and walking and everything. But what you need to understand over here is graded exposure or graded elevation of activities is what is the most important thing. For example, if anyone comes to me, if any patient comes to me with fibromyalgia, I ask them to start off with simple exercise like walking for 5 to 10 minutes a day is as a beginning is what is good. After that, you need to keep increasing, right? Every 2 to 3 days, increase your activities, increase your exercise by every, like for example, 15 minutes. You were doing 10 minutes before, do 15 minutes the next day, and then slowly increase till you reach half an hour, right? Never go into exercise like too much, like 1 hour of walking, 1 hour of gymming. You're going to end up aggravating your condition, right? So start low, go slow is what is the mantra for managing such patients. Complementary therapies are also equally effective. Remember one thing with fibromyalgia patients, I have to share from my experience. I always tell my patients this, that there is always going to be a waxing and waning of symptoms. I mean that sometimes your symptoms might be very severe. Sometimes you may feel that you are in a lot of pain, and certain days you may feel that you're totally normal. You feel that nothing is there at all. Why does this happen? Because remember, it's a curve. It's a graphical curve of symptoms which you need to keep in mind over here. And I always tell my patients that whenever you are having symptoms, you need to understand that this is a problem which is cannot be treated. Yes, fibromyalgia is a treatment which cannot be, is a condition which cannot be treated. There's no end for fibromyalgia as per the studies. Of course, there has been remission in most of the patients after it after maybe once they reach 55 to 60 years. But the problem over here is patients need to understand that fibromyalgia is something like diabetes and hypertension. Are diabetes and hypertension totally curable? No, they are not, but they can be controlled. Diabetes is controlled by medications. You're going to keep your sugar levels under control. Hypertension is again going to be controlled by medications, wherein you're keeping your BP levels under control. So fibromyalgia is in a similar way. You need to keep your symptoms under control. For that, compliance to treatment, compliance to therapies is what is the most important thing. One of the maximum reasons why patients suffer in fibromyalgia is that they are not compliant with the treatment. They take medications for certain periods of time and then they stop the medications. What is important you need to know is whenever you start these medications, I just spoke about the FDA approved medications, right? So whenever you start this medication, what is important for you to know is it takes at least 2 to 3 weeks for the medicines to show any effect. Onset of pain relief only takes about 2 to 3 weeks. So it should not be like you start taking the medication, you've seen for like 5 days, there's no use, and you're just discontinuing the medication. That is not going to help your condition at all. So remember, fibromyalgia is a condition, is a chronic pain condition, something similar to diabetes and hypertension, which cannot be cured, but can definitely be controlled. Right. So let's have a look at a few interventions what are done. So something called the trigger point intervention. So interventions, what you can see over here is me doing a trigger point intervention. So what is a trigger point intervention? Let me just give a few basic idea about it. Remember, I said that muscles are also involved. Patients have muscular pain, right? And whenever a muscle is developing pain, or whenever you've developed a muscle catch, what happens? The muscle fibers inside the muscle tend to develop knots. These knots are called as trigger points, right? So whenever pressure is applied on the trigger point, there's going to be a lot of pain. The patient is going to wince in pain. So there is a new kind of, there's an advanced treatment called trigger point intervention, wherein using an ultrasound machine, we localize where the trigger points are in the muscle, and then using just a local anesthetic mixture. That's it. No steroid over here, just local anesthetic. We are going to reach the trigger point, break the trigger point, and then the trigger point is going to get released. Most of the patients get beautiful relief from the trigger point interventions. Other thing is something called as infusions. This is usually kept for resistant cases, in the sense of patients who are not being recovered from the fibromyalgia, and they have been literally suffering from fibromyalgia for a very long time, and the medications are not helping, interventions are not helping to them, and the pain score is definitely not coming down. Then we, for this chronic resistant patients, infusions are used. Lignocaine infusion is what is usually commenced with. Ketamine, the NMDA receptor antagonist, has also been tried, and its infusions have also been done. Remember, all of these are targeting the central pain mechanism. They are trying to decrease the sensitivity of the nerves so that the patient is coming up, is helped to come out of the vicious pain cycle. All right. So, psychotherapy, very, very important. These are the pillars of management of fibromyalgia: pharmacotherapy, physiotherapy, psychotherapy interventions. All of these are equally important, and should be given the utmost care and importance of patients, to make them understand that psychotherapy is equally important. Many of the time, a patient may end up misunderstanding you, that why are you asking me to go meet a psychiatrist or a clinical psychologist. But it's our job to make them understand, and for the patients to understand this fact that everything is a cog in the wheel. Everything is very, very important. Each and every management therapy is very important for taking care of this fibromyalgia. All right, then. So let me finish off this presentation. Let's have a look at the take home message. These are the points which you need to keep in your mind. Okay. First thing is, fibromyalgia is definitely not a myth. It is very, very real. It's a reality. A lot of patients across the globe, and even your near and dear ones, or in your extended families, you might be finding a lot of people with such kind of symptoms and problems, who have not yet been diagnosed or identified with this kind of problem. It is real, it's a fact. And multimodal approach is what is the most important thing for managing fibromyalgia. I have just enlisted the multimodal approach. Let me repeat again: it's pharmacotherapy, non-pharmacological interventions like physiotherapy, rehabilitation, psychotherapy, and aerobic exercise. All of these things are equally important, along with the interventions. So ask for help whenever anyone is suffering from this kind of a thing. Never be shy, and you have to fight out the resistance which is there among your family members also, that maybe it is not a disease at all. Remember, it's not an organic disease. It's more of a functional problem, wherein your blood test may be normal, everything else may be normal. Some days you may also be normal, but fibromyalgia is one kind of a condition which you need to identify at the earliest, and start the management strategies. So we are in the time of mental health awareness month, and mental health awareness is of prime importance, because of you are seeing a lot of things. I mean, a lot of people suffering from mental health. Remember, there is no harm. It is not shameful to ask for help, and anyone suffering from mental health, do reach out to them and see to that they get the best form of treatment as possible. So with this, I'd like to conclude my presentation. It has been an extensive talk on fibromyalgia, and remember that it is definitely not a myth. It is a very, very real entity, and a lot of focus, a lot of importance has to be given to such patients, to see to that they get the right amount of care and treatment. So thank you very much for your patient hearing, and do remember to take care of your mental health. It's not just your physical health, it's not just your body which is important, which you would be taking care with all the exercises and the other activities, but your mental health is equally important as well. Thank you very much for your patient hearing, and I would be concluding my presentation.